Hello friends, today we'll discuss about ICD-10 coding guideline for COVID-19 related diagnosis. Many coders have confusion in coding COVID-19 related diagnosis since these are the new codes. Many coders have confusion on how to use the COVID-19, when to use it as primary diagnosis and when to use as secondary diagnosis. So let us check what we have to follow in ICD-10 coding guideline for coding the COVID-19 related diagnosis. So first is the contact exposure to COVID-19. If the exposed individual whether symptomatic or asymptomatic, if tested positive, you have to give the assigned code U07.1 as the principal diagnosis. Since the patient is having coronavirus and has been tested for COVID-19 positive, so you have to give only the U07.1 as primary diagnosis. For asymptomatic individual which have been on actual or suspected exposure to COVID-19 will be given code as at 20.81 for the contact with an suspected exposure to other viral communicable diseases. For symptomatic individual where there is an actual suspected exposure to COVID-19, the infection has been ruled out or the test has been inconclusive or unknown, here also you can code the code Z20.828 for contact and with an suspected exposure to the other viral communicable disease. Screening code, for screening code also during the COVID pandemic, screening code is generally not appropriate to use. So here we are using the same code Z20.828 for contact with an suspected exposure to other viral communicable diseases. So for the scenarios for screening for COVID-19, we are using the same code Z20.828. For antibiotic testing, here we have to use Z code Z01.84 for encounter for antibiotic response examination. Antibiotic testing is a blood test to determine whether the individual has developed antibiotics to the disease. So here for COVID-19 antibody testing, we have to use code Z0184. For personal history, we have specific code for personal history. There is a history code for personal history of other infectious and parasitic disease, that is at CT6.19. For follow-up visits codes for COVID-19, there is another specific code for follow-up Z09 for encounter of follow-up examination after completed treatment for condition other than malignant neoplasm. Along with the follow-up code, you have to code history code which is Z86.19 for other infectious and parasitic disease. Follow-up visit are actually used for patients which are completely recovered from COVID-19 and coming to follow-up visit for physician. So here the primary diagnosis will be Z09 for the follow-up examination after completed treatment of condition other than malignant neoplasm, which is assigned along with a secondary code Z86.19 for personal history and other infectious parasitic disease. For COVID-19 related diagnosis, so there are many diagnoses related to COVID-19 which are mainly related to respiratory system. So first is pneumonia due to COVID-19. So here assigning codes will be for primary will be COVID-19 positive ICD-10 code U07.1 and J12.89 for other viral pneumonia. Acute bronchitis due to COVID-19, same here also primary diagnosis will be U07.1 and J20.8 for acute bronchitis due to other specified organism. Bronchitis not otherwise specified due to COVID-19, assigning code again same for U07.1 and J40 for bronchitis not specified as acute or chronic. COVID-19 with low respiratory infection and not otherwise specified or an acute respiratory infection, you have to assign code again COVID-19 ICD-10 code 07.1 and J22 unspecified acute lower respiratory infection. COVID-19 associated with a respiratory infection and not otherwise specified, assigning code U07.1 and J98.1 for other specified respiratory disorder. For acute respiratory syndrome due to COVID-19, again the primary diagnosis will be U07.1 and J80. Since all the diseases are due to COVID-19, we have to give the primary diagnosis as U07.1 followed by the specified diagnosis. Now the patient is admitted with pneumonia due to COVID-19, which then progresses to viral sepsis. So here the patient is admitted due to pneumonia and due to COVID-19. So primary diagnosis will be U07.1 followed by the codes for the viral sepsis and viral pneumonia. If the patient is admitted with sepsis due to COVID-19 pneumonia and the sepsis meet the definition for principal diagnosis, here the primary diagnosis will change to sepsis as A41.89 followed by the diagnosis U07.1 and J12.89. Now asymptomatic patient which tests positive for COVID-19 will be given by default the primary diagnosis U07.1 as the principal diagnosis for COVID-19, which we have discussed earlier also. Now the pregnant patient which is admitted for mild COVID-19 and acute bronchitis, here the primary code will come from the pregnancy complication chapter U98.51 other viral diseases complicating pregnancy as the first listed diagnosis, followed by the COVID-19 code U07.1 and J20.8 and an additional code for the number of weeks of gestation from Z3A category. Newborn test for positive for COVID-19 during the birth admission without documentation specifying the type of transmission. Here the appropriate code will be from Z38 category for live or infants according to place of birth and the type of delivery as the principal diagnosis, followed by the U07.1. Patient admitted with viral enteritis due to COVID-19, you have to give a code from U07.1 as the principal diagnosis, followed by the code for the viral enteritis. Now patient with status post lung transplant cataract COVID-19, you have to give a code from T86.81 for lung transplant infection, followed by the code for the COVID-19 U07.1. Hope you have cleared your confusion regarding coding COVID-19 related diagnosis. If you have any doubt, do give your feedback in the comment section and do like the video if you have really liked the information shared in it, and do share the video as well, and to subscribe to my channel to get all the updates related to medical coding. Thank you.